I'm going to start with a very basic question. What exactly is PCOS? Would we say that is it multiple cysts in the ovary, or any woman with irregular periods means that she has PCOS? And what exactly are the symptoms that a lady should look out for to be suspected to have PCOS?
So, PCOS is one of my favorite things to talk about. PCOS is the most common metabolic disorder of women, and it affects 10 to 15% of us. So, it's something that all providers are exposed to. And the hard part about PCOS is that we don't know exactly what causes PCOS. We know a lot of the characteristics of PCOS. We know some features of PCOS that cause the issues, but we don't actually know the etiology of PCOS. But I think to explain the symptoms that women see with PCOS, you have to kind of go back to the pathology of PCOS. And I think of it as kind of a triad, a circle of dysfunction that is based a lot in insulin and insulin resistance, obesity, and inflammation. And when you get to the core of PCOS, that insulin resistance, the high insulin levels, they cause the body to gain weight, to have inflammation, and that in turn causes more insulin resistance. And both of those things cause elevated male hormones or androgens, and those things cause inflammation. And what happens on the level of our bodies is that the high insulin inflammation causes disruption at the level of the brain. So, normally, as women, our bodies are sending signals from the brain in this very coordinated, specific pulsatile way. And that hormone signal tells our bodies to make an egg every month. And when you have that triad from PCOS, the hormone signals from the brain are not coming in the correct way. And so we don't go through that normal cycle of making an egg every month. At the level of the ovaries or the eggs, that's also causing issues with the environment. So they're not developing as well as they should, they're not functioning as normally. And it also affects, from being a fertility specialist, it affects how the eggs actually create the embryos and how it implants into the uterus as well. So that dysfunction and dysregulation at all these different layers in a woman's body cause the symptoms that we see with PCOS. So what a woman is going to present with first is irregular cycles. So she may skip periods altogether. The cycles can come irregularly, like every 3 months or 6 months. Some women never get a period without taking medications that have PCOS. They're going to see elevated male hormones, either in blood work when they go to the doctor or something symptomatic like elevated hair growth or even balding in a male pattern. And so those are the kind of symptoms they can see: fatigue, easy weight gain, difficulty losing weight. That irregular bleeding can also not only skipped periods, but it can be frequent cycles. And so those are typically the symptoms that women are going to present with. And as a fertility physician, I often see women that have PCOS because that lack of making an egg every month and not ovulating also contributes to their infertility.
Yeah, absolutely. So, Dr. Brown, you also mentioned insulin resistance. Now, can you expand a little more on that? We often talk about insulin resistance mostly in the context of people who are overweight or obese and the diet and lifestyle that's contributing to it. So, would we define PCOS as a diet and lifestyle disorder? And are those the only factors that are leading to PCOS, or is there something else also that may be contributing to people who have PCOS?
Yeah, it lifestyle factors matter, and they are the number one treatment, but they're not the cause. Um, so that underlying insulin resistance that women have with PCOS is what causes the dysregulation of the system. And when I watch like podcasts or experts talk about insulin resistance, it's always my favorite thing to hear the analogy that we use for insulin resistance and sensitivity, because I think it just really shows, that person's personality. My analogy is like a nightclub, and you want to think about, and I explain it to my patients this way, think about a group of people that really want to go to this fancy nightclub, right? They want to get inside, but the door is guarded by a bouncer, right? And your name has to be on the list to get inside the club. So, in this analogy, the club is the cells. So, let's say it's your skeletal muscle, and the glucose or the blood sugar are the people standing in line, and the bouncer and the list are insulin and the insulin receptor. And so when you have insulin resistance, think of it like the bouncer is there and it's preventing the people from going inside the club. And sometimes that's really important. Like, you need to protect the cell for whatever reason. And we'll talk about, I hope, some physiologic times for women that this is actually really, really helpful. But in excess, if you have such a resistance to get inside the club, inside the cell, now you have these people standing outside getting rowdy, right? So now you have all this blood sugar. You're going to call in more bouncers, right? You're going to keep more people out because now there's all of this kind of mayhem outside. So that extra blood sugar, where is it going? It's going to the liver. It's causing fatty liver. It's disrupting, as we talk about the female reproductive system, it's disrupting the brain. It's disrupting the ovaries, all of those things that we are talking about. So women that have PCOS, their system is already naturally set up this way. And we don't know exactly why, but if you think about it historically, the body, and I tell patients that have PCOS, it's actually created very beautifully for times of famine, for times of stress. Like, you really want your body to be able to live in a time where there's not a lot of food, there's stressful events. Women that had PCOS were probably protected, which is why it may be so common in our current, our current population. But when you have high levels of sugar everywhere, processed foods, lack of exercise, then that insulin resistance becomes a problem. And we have all of these downstream effects and manifestations of that. But lifestyle didn't cause it to happen. It's just predisposed to be that way. The reason lifestyle is the number one recommendation is because getting our bodies back to the way that they were potentially meant to exist, with high levels of activity, whole foods, a lack of processed foods, then the system works well. The glucose goes into the cell, people go into the club, they do what they need to do, the system functions really normally. So that's why, I try to always frame these pathologic systems right now in a more positive way, because I don't want women to feel like they're broken. They're not broken. The system is made to function really well. It's just not our current environment.
I love the analogy. I've never heard of it. It's very impressive how you can explain it.
Tell you, it says a
Um,
lot about the person
I
when
know,
you listen to
right?
their analogies. Yes.